Assalamu alaikum warahmatullahi wabarakatuh. Dear brothers and sisters in Islam, today we shall be talking about conjunctivitis. In this environment, a lot of us call this disease condition Apollo. Conjunctivitis is an inflammation of a lining of the eye. The lining of the eye is conjunctiva. So if there's an inflammation of this lining of the eye, it is called conjunctivitis. Usually presents with some reddening in the eye, some discharge from the eye which may be purulent or which may be clear, depending on what has caused this conjunctivitis. A lot of the conjunctivitis that we have in the environment and that which is actually referred to as Apollo is caused by viruses. What that means is that the inflammation usually has to run its course. But in running its course, what can we do? One, to prevent contracting conjunctivitis, and two, when we do have it, lessening the discomfort and the duration of the disease. In preventing conjunctivitis, the first thing is to reduce our contact with the person who already has it. Two, we also reduce the contact with what we call fomites. Those are handkerchiefs, towels that this individual has used, so that we also do not contact it. Usually by the time you've touched these items or you've even shaken the dirty hands of this patient who already has it, you are likely to rub your own face with it and then you contact it. So we're very careful with the way that we interact with individuals who already have the inflammation. The other thing that we need to talk about is how these individuals reduce the discharge that is coming out of their eyes. In this environment, we hear a lot. People say, oh, put engine oil, put this, put breast milk, put that. In event, what should have been an easy disease that could easily be cured, that the individual may not even require any serious treatment, then becomes converted to one that would eventually damage the eye, because I do not understand how you can put engine oil or put breast milk in the eye. Now, what you're advised to do is to always keep your hands clean. And if you're the one with the conjunctivitis, what you need to do is to keep the eye free of a discharge. Very easily done. Get a clean cotton wool, a swab like we say in the hospital, and then you've boiled water, let it cool a bit, and then put a pinch of salt in this water. Put the cotton swab in it, wipe your eye from the bridge of a nose outwards. Drop that cotton swab and take another one and do the same for the other eye. If you do this regularly, you realize that you are free of a discharge, and within no time at all, you're free of inflammation. However, if the inflammation had been caused by bacterial infection, then you may require some treatment, and it is better to seek proper orthodox advice instead of going from one person to the other. This one will tell you, oh, when it happened to me last year, I used this and that, and eventually you do end up with more problems than you bargained for. The other reason why people may have conjunctivitis is if you're reacting to something, dust, pollen, or even to perhaps a drug that you've taken. If it is an allergic conjunctivitis, all you need to do is once you identify what you're reacting to, you move away from this whatever is the allergen causing the inflammation. So it's actually a very simple thing to deal with, but we are the ones who, by listening to what people say and using what we should not use on the eye, convert it into something that is worse than it should be. Well, I hope that with this very few advice, whenever we do have conjunctivitis, we'll take this advice and not convert it into something more dangerous. Until I come your way again, Assalamu alaikum wa rahmatullahi ta'ala wa barakatuhu.